Welcome to the Health and Public Housing Podcast, where we provide information and hold discussions relevant to the health and wellness of public housing residents and other HUD-assisted families, as well as other underserved communities. The podcast is a production of the National Center for Health and Public Housing, or NCHPH. NCHPH is dedicated to improving health outcomes and achieving health equity for residents of public housing and other underserved communities. In support of this mission, we offer training, technical assistance, research, and partnership building. This podcast will provide insights on HUD Strong Families Initiative. My name is Bob Burns, and I'm the director of the National Center for Health and Public Housing. Now, let me introduce our guests. Today, we're pleased to have with us from the U.S. Department of Housing and Urban Development, Office of Public and Indian Housing, Community and Support Services Division, two leaders of the HUD Strong Families Initiative, Maria-Lana and Lewis Dorman. Maria-Lana is a public housing grant manager, and Lewis is a ROS program manager and a Jobs Plus grant manager. Now, let's hear from our guests. These are folks who have been involved in improving the lot of residents of public housing and other HUD-assisted families for a number of years. And they are heavily involved in the Strong Families program, which we're going to talk about in depth today. And so at this point, because we've got an audience that is made up of a mix of health center folks, social services folks, and with a smattering of public housing people, if you could kind of give just an overview of the Strong Families Initiative at HUD, where it started and where it's going now. And I'm going to start with Maria-Lana, who's been involved with this, I think, just a little bit longer than Lewis. So Maria-Lana, take it away.
Yes. Okay. Thank you, Bob. And hello to everyone. Good afternoon. It's a pleasure to be a part of this podcast for the National Center for Health and Public Housing. As Bob mentioned, I am Maria-Lana, and I'm representing the U.S. Department of Housing and Urban Development, HUD's Office of Public and Indian Housing, specifically the Community and Supportive Services Division, which is where the HUD Strong Families Initiative is housed. I'm here joined with my colleague, Lewis Dorman, as well, and he'll speak shortly. But just to give you just a quick snapshot of HUD Strong Families, one, I want to reference the website so that you can have it throughout this conversation and shortly after. It's www.hud.gov/strongfamilies. So the HUD Strong Families Initiative actually initiated several years back in HUD and public housing. Initially, it was titled Father's Day, where at the time, federal agencies began during the Obama administration to really focus on fathers and the importance of supporting fathers within communities, in this case, public housing communities. But in addition to that, supporting fathers who were returning citizens after being previously incarcerated. And so we began an annual pitch or campaign to the nation's 3,200 public housing authorities across the country that to basically join us and sign up for this campaign or pledge, if you will, to have these great Father Day events around Father's Day across the country. And we pretty much left great flexibility to public housing authorities to do what they wanted to do as far as great community events that would engage all family members. So we had the whole 9 yards of barbecues, art festivals, the whole 9 yards, indoors and outdoors. Since then, over the years, we have changed our branding to include all members of the household and any type of caregiver, and that could be now beyond a father. So we have now branded this great initiative as HUD Strong Families, and it is growing strong as we speak. This HUD Strong Families Initiative is now about not only fathers, mothers, caregivers, supporting grandparents, supporting children, of course, the elderly, individuals with disabilities, et cetera. And so we want to basically meet families who live in low-income housing where they are, ensuring that every family counts and every member in that household counts. What that could include and has included this year is a plethora of opportunities, and mostly done through the webinar, online, because we've had the pandemic for the past 2 years. But we have focused on financial empowerment, which just ended. We had a National Financial Empowerment Month, and every week HUD hosted various phenomenal financial webinars to allow housing authorities to access resources to take to the households to enable families to save, to access information, to create an equitable space as far as financial empowerment. We're now going into May, being Mental Health Awareness Month. We are focused on weekly webinars around mental health. Lewis can talk about that. He's our lead on that. We are focused on providing every child in public housing free books. So we do that through our book initiatives to ensure equity and that children have access to books. We are ensuring that every child has access to nutritional meals and services, all kinds of nutritional snacks while school is out and throughout the year. We do that through our partnership with USDA. We are focused on just about everything. I mean, I could go on and on and on, but we want to ensure that I said every member in that household, from cradle to career to retirement to aging, has equal access to the supportive services that they need to accomplish their overall goals in life. So we have a great team at HUD working every day on this. We want HUD Strong Families to be a household name. We are definitely involved in health related opportunities. For the past 2 years, HUD has been known for doing some of the best COVID related and vaccination support webinars and resources, in which other agencies have partnered with us on and even followed our lead. We are involved in promoting health workers in communities and using residents, public housing residents, as health workers and coordinators. We are, again, all I can say is we're involved in attempting to meet families where they are. So great initiative, great partnerships, phenomenal public housing authorities who are committed to doing this work, and a great staff at HUD who are collectively involved. Lewis, did you want to say anything specifically about what you're doing?
Sure. Thank you, Maria-Lana, and thank you, Bob, for having me here. As Maria-Lana said, you know, she's the leader of the HUD Strong Families. She with Sandra Norcom, and I'm leading our collaboration with the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, SAMHSA. So last December, HUD and HHS announced an expanded partnership, as well as the development of a new Housing and Services Resource Center. Building upon that relationship, HUD and SAMHSA decided to collaborate together, specifically to recognize National Mental Health Awareness Month, which is now in May. And to do this, we've set up a series of 4 webinars that are taking place each Wednesday throughout the month, from 1 until 2 Eastern Standard Time. We had the first webinar this week on Wednesday. HUD's Deputy Secretary Adrian Todman, along with SAMHSA's Assistant Secretary for Mental Health and Substance Abuse, Dr. Miriam Delphin-Rittman, kicked it off, and the keynote speaker was SAMHSA's Chief Medical Officer, Dr. Neeraj Gandotra. And that was just kind of like an introduction to mental health 101. It's for this project, this collaboration, it's myself, along with SAMHSA's Director of the Office of Behavioral Health Equity, Dr. Mary Rory, and her advisor, Lysandra Purcell. We've been the main organizers of this series. And one of the big, you know, the highlights of this collaboration is, you know, leading up to SAMHSA's launch of the 988 Suicide and Crisis Hotline, which will start in July. Then that'll also be the focus of our next webinar on the 11th. We'll have SAMHSA's Assistant Secretary, Dr. Delphin Rittman again, as well as Dr. Richard McKean, who's the Chief of Suicide Prevention Branch at SAMHSA. He's going to be talking about, what exactly is 988, how it will work, and how this will be hopefully, a massive improvement on what, what suicide prevention tools and resources were available before.
Lewis, can I jump in for a minute?
Sure. Yeah.
You're touching on mental health, and it's been such a key issue. And when you look at the numbers, HUD-assisted folks generally have higher incidence of various chronic disease conditions, including mental health, issues due to a number of factors, a lot of it having to do with environment and experience of trauma and violence, as well as, lack of health and other social determinative health related issues. So I'm wondering, though, from HUD's standpoint, from the public housing standpoint, because you're speaking to a lot of folks who are probably health people, what does HUD hope to, achieve through the initiative? And what can health providers and those who focus on mental and behavioral health in particular do to assist you in your effort?
Oh, okay. What we want to achieve for sure is we want to bring, more awareness to mental health issues. You're very right about, the disproportionate, amount of mental health issues that HUD communities are facing. And, along with this, one of the biggest obstacles is the stigma that exists for those who suffer from mental health issues. The stigma that, it's not culturally right, or it's just not, what people normally do to seek help. Or they might not, or just kind of a lack of awareness that's kind of just the way things are. So we want help, but we want to be able to help to reduce this stigma, provide more awareness, connect people in our communities with the Housing and Services Resource Center, as well as our service coordinators, working with HUD Strong Families, working with CSS, our other programs, FSS, Ross, and Jobs Plus, where we have service coordinators, and hopefully they will have better training too to help work with our communities. It's really good, if to ask the question like how they can help us. It would be to if they could, reach out to the local housing authorities to see, what interests they have in common, and what, and how they might be able to support them. Sometimes that can be difficult, and if this is the case, just with communication, we're very happy to to make the introductions and encourage building the relationships.
Well, let me ask you a related question, and that is, I guess one thing that comes to mind is mental health first aid, and I'm just wondering if there are any kind of initiatives to get that kind of training out to folks, because again, that's training that's geared really for lay people, and it gives them an idea basically on when somebody might be having an issue and when they might want to help them identify services. So you're not suddenly going to be a psychiatrist or a psychologist or a counselor, but you may be able to identify a neighbor who's having an issue and maybe be able to assist them find services just based on through some of the training. And it's a pretty worthwhile program, and I don't know if you guys have looked at that, but it might be really helpful kind of going forward. So have you looked at mental health first aid, or?
Not, I guess per se. Is that specific? That's the name of a specific program?
Yes,
or just
it's a program that I don't even know if it was initially developed in this country. It might have been initially developed in Australia for some reason, I'm thinking, but it's now international. and the training is fairly inexpensive, and it's well known and widely accepted, and it just might be worth taking a look at. So I won't get you caught up in that rabbit hole, because I know it's hard to cover everything. But something you mentioned before, and that is, who a health center or a health provider might reach to in the housing agency. Sometimes we'll get feedback from health centers that say, I tried, to reach to the housing agency, but I just couldn't get to the right person, or I just couldn't put it together. So is there some tips that you might give to folks on who to reach to and how to reach to? And at the same time, if I'm in the locality and I reach to my public housing agency, or if I reach over to maybe somebody who's running a RAD development or a multifamily development in the same way, and I can't seem to break through, is there any assistance that maybe HUD or somebody in a regional office or a field office could provide? And that's a question for either of you guys.
Yeah.
Maria-Lana?
Yeah, Maria-Lana?
Sure. Okay. Can you hear me okay?
Yes.
Okay, so yeah, we recognize that it can be challenging to navigate through a public housing authority staff roster. Where do you start, right? Depending on which agency or what your interest is. What we recommend is that you start with usually a resident services division. You can contact a public housing authority, and usually you'll hear something related to, if you are wanting to speak with a resident services division or director or staff, please press so-and-so or call. We don't want you to necessarily call a number of individuals to try to figure that out, but usually there is a lead program person, a resident services director that will be listed and will serve as a prime contact. On HUD's website in general, www.hud.gov, if you go to the public and Indian housing link, there is a map which indicates every housing authority across the country. You can actually click on the map and you'll see a roster of housing authorities in the city and a telephone number or website. And on that website is where you begin to hopefully navigate and contact the Resident Services Division. For the purposes of this podcast, again, HUD Strong Families, that website that I referenced, the HUD.gov/Strong Families. We'll have some information as far as how to contact us. You can send us an email inbox. We will put you in contact with the appropriate housing authority that you might be interested in contacting in your city. And also this is helpful because we may need to update our website to ensure that there's some user-friendly information on there about how you can easily contact a lead person in that housing authority, all pertaining around resident services. The other thing that I wanted to mention, just to bounce on Lewis's, great comments here, was that, we also partner with the federally qualified health centers. We have a history of working with these centers. Usually there is a center across the street, up the street, within walking distance, and your viewers are probably very familiar with these centers. But we attempt to coordinate so that everything that we're doing that relates to public housing, particularly in the health world, is also coordinated or collaborated with the with the federally qualified health center. Those particular medical individuals, doctors, nurses, staff, etc., are usually directly involved in events, efforts, online opportunities with these housing authorities. They are not strangers to supporting residents. Residents are walking through their doors every day for a number of medical or health needs. We are attempting to do a better job at coordinating and outreach, but usually between the housing authorities, resident services staff, and these federally qualified staff teams, we have a great marriage as far as point of contacts.
Well, that's great, and I'm glad that you brought up that connection. And you guys were talking, I think both of you earlier, about efforts on the part of leadership, both at HHS with Secretary Becerra and at HUD with Secretary Fudge, to really, to try to focus on quality of life issues and the health of HUD-assisted families, nationwide. And I think Lewis mentioned the resource center, which was put together a few months back, and then back right around this time last year, the secretaries signed the joint effort around COVID-19 activities, promoting vaccine and cooperation across the board. And it's really a real bright spot for us at the National Center for Health and Public Housing, because it's the kind of collaboration we've really been pushing and advocating for a number of years, and it's great to see it happening. Now, as part of all that effort and recognition that there's a great relationship between health and housing, we have the social determinants of health. So everybody talks about the social determinants. And so it's a broad mix of whether it's health or housing or economic empowerment or education or physical environment or transportation or jobs, et cetera. So it's kind of all the things that really impact somebody's chances at being healthy. And it's really impressive that in Strong Families, I mean, you've identified three of the most important. So you've got health, economic empowerment, and education. So I'm going to come back to health and talk a little bit about maybe how the health centers can be more involved or how they're involved, and other health providers. But talk a little bit about the education piece and the economic empowerment piece, and what Strong Families is doing there, and the kinds of resources that are available to HUD-assisted families. And also, is the program just limited to HUD-assisted families, or really is it anybody in the neighborhood who could attend, for example, if you're having an event or something?
Sure, great questions. So to answer your latter question, HUD Strong Families is not only limited to families in those communities who live in public housing. We say HUD-assisted families. We know that the communities expand beyond a public housing development. So we never want to restrict anyone, regardless of background, from joining in or participating. But we do try to prioritize really supporting the needs of the leaseholders and the families and the household members who live in those households. But certainly where there are events, prior to the pandemic, we had these phenomenal in-person events that I mentioned earlier. Mm-hmm. Come one, come all. There wasn't any, specific limit or restriction. But of course, housing authorities got very creative doing some virtual opportunities and outreach. So certainly we welcome all members of the community and expanded community. As far as to answer your question regarding education, so even beyond HUD Strong Families, the Office of Public and Indian Housing and Community and Supportive Services staff, if you will, has had a history of focusing on education, sort of using housing as a platform to improve the educational outcomes of young people and people in general. And so HUD Strong Families is just a vehicle to uplift those efforts and offer resources, examples from the Department of Education and other nonprofits on how housing authorities can build on improving educational outcomes for children and young people. One example that we focused on, and we will continue to build on this, is enabling young people who are college bound or at that age in high school to get to college, right? The first start, as we know, research shows that if you can help a low-income student complete their free application for federal student aid, known as FAFSA, then once that application is completed, they're on their way a little bit further, a step ahead, to be able to then apply for college, wait to understand what they're eligible for as far as financial aid, and then be able to complete a college application and hopefully enter that college or community college and or vocational training institution, because we know that not every young person is interested in college. Mm-hmm. Not every individual is interested in college, but they are interested in a career pathway. And so we want to use HUD Strong Families, again, to help meet families where they are. What are your educational goals? How can we help you get there? What resources can we offer? How can we work with your housing authority to then be able to, be able to bring these resources into your home? HUD Strong Families, what does that mean? We are empowering families. We are meeting them where they are. What, again, based on your need or your individual development pathway or plan. And so with that, I mentioned the FAFSA enrollment process. We have also focused on early childhood education. And again, these are areas which are not foreign to HUD, but we know that there are other federal agencies that focus and have appropriation dollars on these resources like early childhood education. So HUD, we can get with the housing, we can offer supportive services, but that's when we sort of advance our efforts to partner with Health and Human Services, who, for instance, leads the Healthy Start or Head Start program. We want to make sure that where there is a Head Start program, our parents or young parents can enroll their kids. They know where these programs are. If they are in need, the biggest need in public housing is childcare. Okay, it's in addition to jobs. We can help families or head of households get employed, but if they have childcare needs, that's another issue. That's a barrier. So we're focused on that. We're focused on early childhood education. And most of the time, we're reaching out to the experts that can help us get there. So these are, again, just examples. You asked me, Bob, about the education piece. Sorry, I went on a little bit.
And actually, you know, within the education piece, I know that you mentioned job training as part of that, a component of the education effort. And obviously a major issue, you know, is economic stability, and to get there, a job is the key, and hopefully a job that takes you someplace. So one of the things that health centers, community health, you know, federally qualified health centers have always tried to do is to use the health center itself as an economic engine for the community. So to hire within the community, to hire vendors from the community, so on and so forth. And one of the things that's going on right now, and it's kind of timely, is that there has been a great recognition of the value of community health workers, you know, sometimes called patient navigators or promotors, or peer counselors, something in that range. And basically, they're folks from the community who receive training, work with the health center, and they perform kind of a variety of functions. You know, they're kind of a liaison. They're somebody who deals with support services. During COVID, I mean, there was great value. A lot of people, you know, you had community health workers who were, you know, doing kind of wellness checks on residents, you know, maybe helping somebody make sure they got their prescription delivered or food delivered, and also going back and reporting to the care team, you know, at the health center itself. And community health workers have been around for a long time, but they have really gained a higher profile in the last couple of years. I think partially because COVID really demonstrated the value, you know, across the board. And also for the healthcare system, which, as you know, is very costly. Community health worker is a lot cheaper than a doc. You know, not that I'm equating that they'd be doing the same kind of services, but just in general, it's a very good investment for everybody. It's also a way into the career path for somebody who might be interested in either allied health or any component of health. So, and as it turns out, for example, HHS just put out a grant opportunity for those who want to do training for community health workers in the neighborhood of $250 million. And that's big bucks for training. But they're looking to hire, you know, literally thousands of community health workers and train community health workers nationwide. So all I'm saying is that, first of all, the health center might be a source of employment and career development. And at the same time, there is an immediate need right now, and the positions are not, I mean, you're hearing salaries. I mean, when they first started around 20,000, then 40,000 in some states, like 60,000. So it's getting better. And I think, you know, CMS, you know, Medicaid and Medicare are making more efforts to reimburse better, which allows health providers to pay better. But it's an opportunity that I hope, you know, that you guys might consider in your next. Now, I know you're in the middle of Strong Families now, but I would think there are probably a lot of folks who might be willing to speak with you about some career opportunities that are there. And it's also a great way to enhance the partnership with the health center and the community, because what they did in a lot of the housing agency health center partnerships during COVID was they would have a community health worker who was an employee of the health center, but was very, very much in contact with the residents and the resident councils and the resident services folks in the housing agency. And as I said, CHWs or peer counselors can be involved in all different types of services, whether it's just, regular primary care, or it might be, somebody dealing with behavioral or mental health issues, smoking cessation, any of those things. So it's just something to consider as you're going forward. And then, and to come back now to, and there's so many things we could talk about. So I want to get back to your primary focus on strong families. So we talked about education. So let's talk a little bit, and we kind of talked about it a little bit there for a minute, but in terms of economic empowerment, what kinds of, resources are out there, or what kind of trainings or connections, or, what kind of boosts up are you trying to give people through strong families in terms of employment? And Maria-Lana?
Yeah, and Lewis, you can chime in as well.
Oh, yeah.
Well,
Sure.
I would say that one of the programs that we offer, and this is a little beyond HUD Strong Families, but again, we're using HUD Strong Families as a platform to sort of uplift everything we're doing and expand these resources so that every housing authority and every family that lives in public housing has access, regardless of if they are funded through a public housing authority or not. So the one thing that we have the Jobs Plus program, and that focuses on providing career pathways to leaseholders or public housing residents as they work. Their wages go up, their rent may not go up immediately, but that program offers a plethora of workforce development opportunities for leaseholders, and they work closely with community coaches. You spoke about the healthcare navigators or coaches and healthcare workers, their various names, but doing something similar, using residents as peers and partners to motivate other residents to create a culture or an environment where my neighbor next door is doing very well. He or she is saving, and they've learned through HUD Strong Families about these great programs, how they can save, how they can access online opportunities. I want to be there too. And then my community coach or Jobs Plus coach, who is a resident, comes out, they're the boots on the ground, they're knocking on the doors with you to say, hey, were you aware about this job fair today? Did you see your case manager today? Did you know that there's a partnership with the health center across the street for getting vaccinated, but also you can sign up for a job interview. There are going to be some employers hiring. So information sharing, but using these individuals, training them, getting them the skills that they need so they get a job, but also maintain that job, get a career pathway, have a sustainable wage. It's just a start. So you start with, we're going to hire and train residents to do this work. And hopefully through the skills and opportunities and the partnerships that are offered, we are now putting them on track to do some work that they enjoy, and they can get paid, and they can help other residents along the way. So that's just an example. But we're doing quite a bit with the Jobs Plus program. And then also just ensuring that even with leaseholders, if there are youth or young adults in the home also, we're providing them with either summer youth employment opportunities or year-round apprenticeship programs where these young people can determine through some skills or shadowing or paid training what they want to do, when they grow up, and or if they want to enroll in college or vocational training institute. So just really focused on employment in general. We work closely with the Department of Labor. Again, I said that we can't do this alone at HUD. So we rely on these federal agencies who receive appropriations, but are also serving the same populations. We're all serving the same populations, whether you're at Department of Labor, Health and Human Services, USDA, Department of Justice. We all come back to the same families. And so our goal is to coordinate and ensure that families have access, for instance, to what you just said, employment opportunities. Lewis, did you want to add anything?
Yeah, thank you, Maria-Lana. Just also the, HUD Strong Families has a partnership with the Consumer Financial Protection Bureau. And This is one that's been going on for a while. And this is mainly with education for our communities about providing them, with financial responsibility education, credit checks, how to manage their money, help with savings. And right now there's a community of practice module that's going on with the CFPB and our Ross and Jobs Plus programs, as Maria-Lana mentioned, which is training the grantees so that when they're working within their communities, they'll be better able to serve the financial education needs of their participants.
Well, you bring up, or you remind me of kind of I think a point that might be interesting for the audience. And that is, we talked about the difference between public housing and HUD-assisted a few minutes ago. And just in terms of scale, I think we've got about 1.7 million folks living in public housing, traditional public housing, but you've got another, depending on how you count it, between 5 and 8 million who are living in HUD-assisted properties, whether it's multifamily developments or people using project-based vouchers or tenant-based vouchers and all that kind of thing. So can you explain a little bit about, if I'm a health center in my community and I really want to, make a difference in terms of working with the people who are providing housing. But in my community, I've got a RAD development, I've got a traditional public housing development, I've got a multifamily choice neighborhoods, development, someplace in town as well. Who am I as a health center or other provider going to go to in order to make that connection? Do I go to the PHA only, or do I have to go to the developer? And how does that work? Who coordinates all that stuff?
So that sounds very complicated. So my recommendation is to start with the Public Housing Authority first. Again, HUD has a listing of every public housing authority, and I believe that there are about 3,200 across the country. Start with the Public Housing Authority first. I mentioned that there is a resident services division. There's also a housing division. So there you'll get information on the prospects of, is that housing authority planning RAD? Are they a RAD? Or is it public housing, traditional public housing? It's also the voucher department. Is there a grant that will include reconstruction or mixed income, mixed financing, i.e. choice neighborhoods? So and also that website, that housing authority's website will likely offer you an update on recent grants and, plans for a particular community. I would start there, but also let me go back to something that Lewis mentioned about the, I think we were talking about the financial empowerment piece, and then how this may apply to reaching households beyond just public housing. We are also, as a part of HUD Strong Families and also HUD Strategic Plan, we're focused on wealth building goals for residents. That means HUD-assisted residents beyond public housing also, as well as wealth building goals for the community. So HUD Strategic Plan has a priority, literally, to start listening to residents and community stakeholders, and then to be able to take back what we hear to possibly, can't guarantee anything, but possibly make some improvements to the way we do business. We have a lineup of listening sessions that will start the first one starts on Tuesday. So through May, through the end, from May through the end of the fiscal calendar year to October, every month, we will be holding resident listening sessions. And we will be talking with residents who mostly live in public housing about their wealth building goals and lived experiences and any barriers, and then what we can do at HUD to address those barriers. But we're also reaching out beyond public housing residents. So we want to talk with young adults between the ages of 18 to 25. We want to speak with returning citizens about their reentry challenges. We want to speak with Native American citizens. We're also interested in speaking with residents who may have English as a second language, or the barriers related to that, and financial empowerment. Again, wealth building, savings. What does this mean? And even if you could save and you can't, why? What we can do to help you. We'll be speaking on Tuesday to working parents. So what does that mean when you are on you have a job and you believe that you're on a good career pathway, you're interested, but you have children in the household or young teenagers, and you have to also consider them and their needs. And so, we'll be speaking with working parents on Tuesday. Very exciting. And we're using HUD Strong Families as this platform like never before to ensure that we're reaching all types of residents and understanding how we can help, if needed, to improve their life, their lifestyles, and their goals.
Outstanding. And because in public housing in general, and among HUD-assisted folks, you have a high proportion of folks who have a disability, either physical or cognitive, and you have a high proportion of folks who are elderly. In terms of financial stability, and even your listening sessions, do you make special provision to try to find ways to help them strengthen their families? Because obviously they're presented with some, I think, unique and additional challenges. And for example, Lewis, if you want to maybe touch on, there are folks obviously who have cognitive issues, or who have, and related mental health issues. But again, we're always trying to, improve somebody's quality of life across the board. So are there some efforts there, to deal with, folks who need that little bit of extra help?
Yes, but first, going back to your previous question as well, if there is the healthcare worker that wants to reach out to the HUD communities, is not sure where to begin. Another good place is to work with the Office of Field Policy and Management, FPM. That's HUD's front office, and they have offices in every state of the country, in Puerto Rico, maybe and sometimes more than one office. And these the people that work there, they're able to answer any questions that you have, or at least put you in contact with whom you need, whether it's public housing, multifamily housing, or community policy and development. So and that's their job. So that you can always go to them. The Section 811 program of multifamily is a very good one for those with cognitive. I'm sorry, what was the cognitive disability? I'm not sure if I'm using the correct language. The cognitive disabilities. Sure. This is a great housing program for individuals that that have this type of issues, as well as other either physical disabilities or others.
Okay, that's great to know. And I think what we'll try to do is get some of that information so we can maybe, when we put this together, actually include some of the program information and links to those sites and stuff. So we'll talk to you about that after the session today. And I just want to kind of bring it back because we're actually getting close to time here. And so I just want to come back to, the schedule, I guess, of events for Strong Families, kind of when does it start? When does it end? And I know it's something you guys are working on all year long, but in terms of the actual, events and so on. So if you want to talk a little bit about that and where people can look for information about, about some of the Strong Families events and so on. So Maria-Lana, if you want to take that.
Yeah, sure. So HUD Strong Families is a year-round effort. And also pay attention to Gov delivery, because most of our announcements are going out through, just like the federal government now uses that means Gov delivery to announce every webinar we have and opportunity. And again, that website, HUD Strong Families website that I continue to quote is HUD.gov/Strong Families. There we'll have a pretty user-friendly cheat sheet of what we've done in the past, what's been archived, PowerPoint presentations with point of contacts, and also what's forthcoming. And so we've got a lot, and we are constantly thinking about more, because as we near the end of our fiscal year, which is in October, we're going to start up again. These are year-round opportunities, and we're constantly thinking about, what did we miss? Lessons learned. Can we up our efforts? For instance, you mentioned elderly and people with disabilities. Of course we can. And so we'll be continuing to brainstorm yet a future calendar of opportunities. And health is always on our radar. It's very important, because if you're not healthy, you can't work. If you're not healthy, you can't attend a post-secondary education program. If you're not healthy, you can't take care of your children and or your elderly parents. So everything comes back to health, right? So we are mindful of that, and through mental health, through vaccinations, COVID awareness, substance abuse, suicidal prevention as well. All of these things come to mind, and we are committed and dedicated to continuing to work hard at HUD, I would say, with our team on, again, how we can meet families where they are and helping the nation determine or come to a common meaning about what a strong family looks like, especially when you live in poverty and or you are low income. When we say we want to work together with other federal agencies and partners, we usually start by agreeing that, we understand the plight of low-income families, and or what is our goal? How do we want to help them achieve their goals? So we want to make them stronger, but also they're our partners in this process as well. So we can't help them if we don't include them. And I think that's the importance of these listening sessions and being able to demonstrate that we've listened. Again, can't promise everything, but we are listening and we are trying a little bit better to improve our business.
Well, Maria-Lana Queen and Lewis Dorman of HUD, I want to thank you so much for joining us today to talk about the Strong Families Initiative at HUD. I mean, the idea of strengthening, empowering, and improving the quality of life of HUD-assisted households is just, so important, so closely tied to health and all that we support at the National Center. Would love to talk to you guys further about Ross and Jobs Plus and some of your mental health initiatives. And I just, again, thanks so much for joining us, and please come again.
You're quite welcome. Thank you for having me and having us. It's been a pleasure.
Thank you.
You, Bob.
I hope you found the discussion helpful today. Thanks for visiting with us. My name is Bob Burns, and I hope you'll join us for other health and public housing podcasts. Thank you so much.